gave me the piece of information that I've been missing and that I would have loved to get at the beginning of this whole thing, which is that studies show that it takes from 18 to 24 months to go back to feeling 100% or feeling normal after a hip impingement surgery. It takes a long time. So just so you know as well, if you're feeling stuck, this is a long process. So I guess just keep doing what you're doing. If that's working, then be patient. This is day 13 since my left hip pain started. And today I think I have bursitis. I googled the symptoms and Dr. Google makes me think that I might have it. The bursa is a sac that is in the joints and in some bones, and it basically has that liquid to lubricate the movement. And sometimes because of an impact or a pre-existing condition or repetitive movements, it can fill up with too much liquid and it gets inflamed and it hurts worse than a fracture sometimes. I've had bursitis, in my two shoulders, in my ribs. And now I'm really thinking that I have bursitis in my hip as well, because the symptoms really check. It's talking about pain in the outside of the hip, in the outside of the thigh, in the buttock, the area feeling warm, also feeling more pain when you're laying on that area, and I feel like I check all those boxes. So I think it might be bursitis. I might be lying to myself because I also want to think that it's something that can be fixed and it's not like a chronic thing. I don't know, but yesterday that I was doing my windshield wiper exercises, which is something that I've been doing almost since day one of the surgery, I had pain in my left groin area, and that scares me a little bit because it's never happened. But something that I wanted to share with you is something that a friend said, and I think it's really wise. He was basically saying that I don't really have control over the result of whatever is going to happen in that appointment or with the MRI or whatever exam they do, besides following what my PT has said, resting, being careful of the hip, keep strengthening. But other than that, there isn't really anything else that I can do to change the condition that I have right now. And it's really up to me how I want to live these days, either in despair and stress or just keep living my life with a positive attitude. And I think that's super wise, because sometimes I feel like we don't realize how little control we have over things and we just stressed out over it, and that doesn't really change the result. So I'm trying to have a more positive attitude, to not think about it that much, even though the pain is there every time. I'm feeling a little bit better today and yesterday as well. Just wanted to share that with you because I feel like it's really wise and it makes a lot of sense. Hi, welcome to month 9 post-op of a hip impingement labrum repair surgery, not a hip replacement, please. Month where I feel like this could easily turn into a soap opera. It has the drama, it has the tears, it has everything except the villain. And I really hope it doesn't show up, because I've had enough to deal with. This month has been insanely crazy. There is so much uncertainty. There are so many emotions. To say that I was feeling defeated is an understatement. I hit bottom again, and it has been super tough. But spoiler alert, a couple of weeks later, I feel like I've made peace with whatever is gonna happen with me and my body, and that has given me a lot of freedom. Let's start with the appointment with my surgeon, my MRI, and we'll pick it up from there. I just came out from my appointment with the surgeon, the 8-month post-op appointment, where we were supposed to discuss going back to sports and going back to my normal life, which is clearly not the case because my hip is still hurting. It's day 17 since it all started, and I am super upset. I feel like at this point I can't even cry anymore because I've been crying so much. I cried yesterday a lot. Yesterday was supposed to be my last day of physical therapy. It was my graduation day, which clearly is not, because today I have a new order for physical therapy, and we didn't really end it yesterday. We kind of already knew that this was gonna keep going. And it was really sad because I had to go back to exercises that I did 5 weeks post-op, and that broke my soul. And my physical therapist was really nice with me because I was like, I'm tired, I'm frustrated, and he's like, I know. So, like in these moments, empathy really, really helps, because there isn't really anything else that anybody can do to, change these things. After that, and thinking that I'm off the ice again, not running, not jumping, not doing anything, came today to my appointment. After I told them that I have pain in the left hip, they sent me to x-rays. And when they were doing the x-rays, something came to my mind, and I was like, what if this is a stress fracture? Which is something that I hadn't considered at all. And then when the surgeon came, he didn't diagnose anything, but he asked, he was like, have you ever had a stress fracture? And I'm like, no. So I don't know if that is what's going on. Stress fractures come from like overdoing it and tons of repetitions and like very high impact. So I doubt that this is a stress fracture. It will be really weird, but I don't know. At this point, I really don't know what's going on with me. So he said that we need an MRI, third MRI in 1 year. That will allow us to know what the heck is going on inside the hip. It seems he didn't say anything very specifically. However, it looks like since the pain is more in like my butt outside hip area, he's not super concerned that it's the same thing. He did do the evaluation of moving and like putting me in an impingement position, and it did hurt when he was like going all the way in. But reading between the lines, it doesn't seem like he thinks that it's the labrum. So we'll see what happens. I have to get an MRI as soon as possible. As of now, I have another order of physical therapy, and they recommended to take pain pills, and that's it until we know what's going on with the MRI. Yesterday, my physical therapist said that they might suggest another cortisone injection in the other hip, in the left hip, but the surgeon didn't say anything. He said that he really wants to see that MRI to make a decision. So that's where I'm at right now. Very disappointed and sad. I'm so much stronger and faster, and I guess I was just like very high up, and the fall hurt horribly. Very, very frustrated. I am scared, I'm sad, I am devastated because it looked like I was finally getting there. Let's talk about the bright side of this, which is the right hip, ironically. The surgeon is really happy with the right hip. He said that it's normal, that it still hurts every now and then. He did a test as well of like range of motion, and he said that my external range of motion, well, like all of the range of motions are very good, and that my external range of motion at this point is average, which is insane because I feel like I can barely like take my leg out. I don't know how to say that, like move my leg out, externally rotate my hip. And he said that it makes sense because when you do sports that require opening the hip a lot, when you have a normal average range of motion, you feel tight because you're not used to that. You're used to like being able to open the hip way more than that. I guess I'm back to like average. Hopefully we can keep working to opening it a little bit more. He did say that he thinks that things are gonna get better, that studies have shown that it takes between like 18 to 24 months to be 100% better, which I really hope they would have told me at the beginning of the surgery. That also is influenced by the scar tissue, and I unfortunately do have scar tissue, so it might take a little bit longer to feel 100%. But he said to keep strengthening, keep doing all the good things, and he's actually really happy with that hip. This was supposed to be the appointment where we talk about going back to sports, which is of course not happening. But he said that maybe if the MRI comes back positive, however that can look like, we might be able to talk about it in the next appointment. I'm gonna have a virtual appointment with them. So yeah, that's where we're at. I guess it gives me a little bit of peace of mind. I don't know. I'll keep you posted. MRI is done. They will have the results ready by the end of the day. I don't know if I'm gonna get them, or at least the surgeon will receive them by the end of the day, and then I'll have to wait for them to set up an appointment to chat with me about the results. I did what was on my plate, and now we have to wait to see what the heck's going on in this hip. I've been feeling a little bit less pain than week 1, for example. It's been 23 or 24 days since the pain started. It hasn't gone away. It hasn't vanished completely. But like 5 days ago, I was a little bit better, very mild pain. And then the day after, I was sitting for like 2 hours just having dinner, and that hurt. And then the next day I was feeling a little bit better, and then yesterday I was not feeling great. And today I do have pain as well while I'm sitting. But again, it's kind of like in this part here. So we'll see. I just hoping for the best. Now it's the wait time. Just wanted to give you a little bit of an update. I got my MRI done probably like a week and a half ago. My surgeon is on vacation, very conveniently, so I'm waiting for him to come back to discuss the results. I don't really understand what the MRI says, so I'm not gonna discuss that in this particular update. But I just want to say for the record that one of the findings of the MRI is tendinitis, and I said it before. So I don't know, I guess I should feel proud of myself because I can get a pretty accurate diagnosis. I guess it also talks about all the different injuries that I've had that have allowed me to diagnose myself pretty accurately. The other things I don't understand, I feel like it's really up to the surgeon to give me the actual evaluation, so we'll see what he says. It has basically not stopped since then, until 4 days ago when things got better. By then, my pain in the glute and in the lower back kind of like went down. I wasn't feeling it that much or that frequently. Then the groin started hurting, and it's a very different pain from the other side. It's more of like a deep pain in there, like very hard to describe. But today, particularly, today I'm feeling well. So we'll see. I'm just trying to make the most of these days. My anxiety has been through the roof, of course, but I'm just trying to live and see what happens. I fell yesterday. It's my first time falling after the surgery, and that is why this is so important. That's why I'm telling you all, because after you have the surgery, you feel like you live in a bubble. Everybody's like so careful with you. You are super careful with yourself. And then when I went back to skating, not skating right now, but like when I went back to skating, I had always in the back of my mind the risk of falling because that's part of my sport. So I was really afraid of it. My physical therapist said that the fall will come and I will realize that I am not gonna break into. My coach said the same. Everybody was telling me the same, and the fall finally came yesterday. And it's kind of crazy how your brain is so powerful, because one of my laces was undone. So I thought to myself, I was like, I hope I don't trip with this lace, and then 3 seconds later I was on the floor. What happened was that I think I slipped and my right shin hit the border of the stair, which was really painful and really, really bad. And then the left knee also fell and hit the ground, and it was kind of like a bad fall. I'm in a lot of pain. I can't really move my foot that much because it's very painful. However, I'm in one piece. My hip is fine because my right hip is the surgical hip, and that's the leg that took the impact of the fall, and I am doing fine. So I will take this as a win. As I was saying, it was time for me to finally lose the fear of falling, realize that I am healed and that my hip is doing great. And I'm excited about that. I'm in a lot of pain, but I'm also super excited. I had my MRI a week after the appointment with the doctor, and then he was on vacation and I was traveling. I got the results. I freaked out. I didn't know what to make of them. We know from the MRI that the labrum on the other side is torn, which is something not surprising at all. I was already warned that that was going to happen. It would have been actually surprising if it wasn't torn, because when you have the condition in one hip, you have it in the other one. The x-rays were showing that it's a little bit of a milder impingement here. It's only in the femur, but it was still enough to tear that labrum. So that's something that we know, and it's something that I am not super concerned about. The doctor is also not super concerned about, but it turns out, and I wish I can find the video where I'm saying this, because I self-diagnosed myself. Because I did some self-diagnosis initially, hoping that this was a tendinitis, which was a tendinitis at that point. Telling myself that this might be tendinitis, and today I think it's tendonitis. The difference between what I have now and the tendonitis is that the tendonitis lasts few weeks. This has lasted almost 2 months at this point, and that makes it tendinosis. So tendinosis means a more chronic inflammation of the tendon, which also has a little bit of like tiny tears, which are normal, the tears that your muscles get or your tendons get when you are working out or when you're doing activity, but that your body is usually able to repair right away. When the rate of repair is the same or higher than the rate of wear and tear, then you're good. In my case, it looks like my body is not repairing at the same time of the wear and tear, so that's where we have a problem. For the record, I knew that I had tendinitis. It turns out that I do have a problem with the tendon. The surgeon's main concern was that the tendon was torn. Thankfully, it's not, because the recovery of that thing is super, super, super hard. So I'm very grateful that it's only an inflammation. Only. It could be worse, I guess. When I spoke with the physician assistant of my doctor, she helped me understand that the doctor is still very, very fixated in the thought that the labrum is not the one causing the pain on the back, my pain in the butt. They want to give me another month of physical therapy, anti-inflammatory pills, Voltaren on the side, and also ice, and then make a decision on how to proceed. It looks like he really doesn't think that fixing the labrum is gonna fix the behind. So they want to see what happens with these measures that I am telling you. So they said that I am allowed to go back to my activities. I cannot run, of course. I cannot do ballet, which is heartbreaking because tomorrow is supposed to start this new semester, the new bimester, or whatever you want to call it, of ballet here. And I was really hopeful that I could go back, and I cannot. That aches my soul. But I am allowed to go back jumping and skating, which I'll take. Of course. It's just a lot of uncertainty. And the idea is that depending on how I feel by the end of that month, I'll talk to my physical therapist and we'll make a decision on whether I should go back to them right away or wait for a little bit. And if I had to go back, if I still have pain that hasn't improved in the back of my hip, then they will, and this, please take it with a grain of salt. I might not understand what I am saying. It's my very limited medical understanding from what they said. They say that they would put a cortisone shot in the labrum to see if that calms the tendon down. If that actually calms the tendon down, then we're gonna know that the labrum is the one causing the whole thing. If it doesn't, then it means that the labrum is not, but I guess it leaves us with the problem of the tendon. So I don't know, it's just a lot. So we'll see what happens. I am back to physical therapy, and I've been doing throughout this month, this happened like a week ago. So I started with the pills a week ago. And throughout that time, I was doing my basic physical therapy exercises every day, and twice a week doing some weightlifting. And now I'm back to physical therapy. I did jump when I was told that I could go back jumping. Of course, I was gonna jump, and that didn't really hurt the hip that much. It did bother me right after, but later it was quite better. After taking the pill, things have improved. Definitely, like it's a pill that is going to help for that specific reason. The first days I had no pain. Now I do have pain, but I do feel like the frequency has gone down. The intensity of the pain might be the same, but at least the frequency is going down, which I think is some sort of improvement. Which is another thing that I wanted to say, because my doctor's team believes that even though I am still in pain, it's been like 50 days since it all started, the pain hasn't increased, which is a good thing. Yes, it's not ideal that I have the same intensity of pain and at that time the same frequency of pain, but at least it hasn't gotten worse, which is a good sign. So that's what's going on, and that's the plan for my left hip. The right hip is actually doing great. That's the irony. And that's what I'm trying to also focus on. And I know that you guys are here to know what's going on with the surgical hip. The surgical hip is doing great. Thank you. It's crazy. I can't believe that now that's the hip that's holding everything together. That's holding the fort. It's the hip that's giving me the satisfactions. It's the hip that I am trusting the most. My mom was telling me this because I've done a lot of work mentally to just make peace with whatever happens. And my mom was telling me, well, you've made peace with the idea of potentially having another surgery on your left leg because your right leg is actually doing great. And that's something to be grateful for. I feel like the surgery did what it has to do. And yes, the recovery has been hard, but it's doing great. So that gives me the confidence of going all in if I have to on the other side, which of course I don't want to, but if I have to, I at least have a first-hand example of what the surgeon's work is, and not only the surgeon's work, my PT's work, his team's work, and everybody that has been around this recovery. And that's another thing that I wanted to talk about, because mentally it's been a very, very tough month. Initially, I had all these catastrophic thoughts of what happens if I can't go back to skate or run or do ballet or dance or do anything, and I cannot imagine life without my sports or just being able to walk free of pain. That brings you down, like it takes you to the darkest place. I've been able to think about it, process that, embrace the uncertainty, as I've been saying, and at this point hope for the best and make peace with whatever happens, which I think is the only thing that I can do, because I can't deal with so much weight on my shoulders. And that's the other pretty horrible thing, I would say, of all of this, is that I had plans and I had plans with people, and people are waiting on this to know if we can do those things. Buy a plane ticket, hire an employee, and things like that. And I feel horrible that I am the one holding them back. And it's just so much added pressure to this. And nobody has been mean with me. I promise. More me being annoyed with this whole thing. But there isn't really much that I can do other than hope for the best and see what happens with this hip. For example, it's in pain right now as we speak, mostly on the side and here, like in this area. But sometimes the labrum actually hurts. Sometimes it burns, like a not fire burning sensation, but more of like a lemon on a wound type of sensation, which is really, really concerning. That's an actual labral tear pathology. But overall, most of the symptoms are outside. So we're gonna see what happens. I'm just going with the flow at this point, seeing the positive with the other hip, continuing with the strengthening because that's super important. We're gonna see what this month brings. I am very curious to say the least. Thank you so much for making it till the end of the video. I hope that I can give you good news next time. Send me all your good vibes, please, because I need them. All your prayers, all your good energy. Leave an emoji with a star or something to help me with the good energy, please. And I will talk to you in the next video. Bye.